So some big announcements today regarding eligibility for third doses of vaccine. And I want I guess, preface this update by saying that first and second doses of COVID-19 remain really the priority. That's what will continue to really prevent significant outbreaks. But we are expanding eligibility for third doses of vaccine in some population age groups, which was outlined by the Chief Medical Officer of Health just an hour ago today. So, as you're likely familiar, the National Advisory Committee on Immunization, or NACI, released an updated statement last Friday with recommendations about groups of population that they thought would benefit from a third dose of an mRNA COVID-19 vaccine. And as usual, kind of process in terms of how this rolls out, the province then issues its own policy directions, which is essentially the go button for its rollout in Ontario. And so they did that today. So there's really two categories that we're looking at for folks that are eligible for a third dose of vaccine. The first category are individuals with moderate to severe immune compromising conditions. So most of these individuals were already eligible or already able to get a third dose of vaccine. The reason a third dose is recommended for this group in particular is that their immune system did not have the same response to 2 doses of vaccine as somebody with a normally functioning immune system. So there's a list of both medical conditions and medications that people might be on that make people eligible for that third dose if they're part of that category. And what's key is that third dose is offered once it has been 2 months since their second dose. And it's considered part of that primary series because essentially it takes 3 doses of COVID-19 vaccine to get that same immune response as 2 doses would in somebody with a normally functioning immune system. The other big category of people that are eligible for vaccine are those individuals now that are either at high risk of having severe outcomes if they were to become infected with COVID-19, or are at higher risk of getting COVID-19 because of their occupation. So for example, healthcare workers. In this category of people, the reason that vaccine is being offered is that there are some early studies showing that when they measure antibody levels in the blood, after 5 to 6 months since their second dose of vaccine, it seems that some of these immune levels in the blood, when you measure them, are getting a bit lower than immediately after their second dose. So there's some early signs that the immune response could be decreasing a little bit over time. That being said, there's no indication that overall vulnerability or the likelihood that somebody's going to get severe disease, or have to be admitted to hospital, have to be admitted to ICU, does not seem to be decreasing over time. So maybe to reframe that in a more straightforward way, even though they're measuring a decrease in our immune system 5 to 6 months after the second dose, you still seem to be equally as well protected, as strongly protected against severe COVID-19 disease, hospital admissions, and ICU. That being said, because we're trying to protect communities against the Delta variant, which we know is much more infectious and which we know can cause more severe disease, hence NACI and now the provincial government is recommending that third dose for certain groups to really be cautious in the event that that decrease in measured immune levels does actually mean in the next couple of months they could be more vulnerable to COVID-19. So the groups that are now eligible, so we have individuals that are age 70 and over, or born in the year 1951 or earlier. if it has been 6 months since their second dose, so 6 months or 168 days, then they are eligible for a third dose of COVID-19 vaccine. For First Nations, Inuit and Métis peoples, including household members and including if on reserve or off reserve, eligible for a third dose of COVID-19 vaccine once it has been 6 months or 168 days since their second dose of COVID-19 vaccine. For healthcare workers, and this also includes essential caregivers, and that's especially relevant for long-term care homes and retirement homes. They're eligible for a third dose of COVID-19 vaccine once it has been 6 months since their second dose or 168 days from their second dose. And then the last category of people that can get a third dose of COVID-19 vaccine are people that had a full series of the viral vector vaccines. So the viral vector vaccines are the AstraZeneca vaccine or the Janssen vaccine, the Johnson & Johnson vaccine. So if somebody received 2 doses of the AstraZeneca vaccine or 1 dose of the Johnson & Johnson vaccine, if it has been 6 months since their last dose, they can now get a third dose of COVID-19 vaccine. If, however, they received 1 dose of AstraZeneca vaccine and then for their second dose had an mRNA vaccine, either Pfizer or Moderna, then they're not eligible for that third dose. So the key for that group of people is that it was a full dose series of AstraZeneca or the J&J vaccine. The reason that that group has been included in the eligibility is that there are some studies showing that a full series of the viral vector vaccine in particular does not seem to be having as great protection against COVID-19 as the mRNA vaccines, which is why they're now recommending that third dose with an mRNA vaccine. So I think key thing you heard me repeat for each of those 4 categories, for all of those 4 categories, third doses only if it has been 6 months since their second dose or 168 days. So we're encouraging everybody to check their vaccine receipts before they book an appointment or before they show up at a pharmacy or clinic to make sure that it has been 6 months since that second dose. In addition, I think a couple of things just to emphasize. The 2 doses of mRNA vaccine, again, still have very good protection against very severe disease or bad outcomes from COVID-19. So there's not, I think, the same urgency around getting third doses as we might have felt for first doses or second doses. Being fully vaccinated is still considered 2 doses of mRNA vaccine. So proof of vaccination, the certificate program, still is 2 doses of mRNA vaccine. This third dose is an optional one. Certainly if people would like to receive a third dose, they are now eligible. They can get that third dose if they're in those categories, but it's not it's not part of the definition of being fully vaccinated. Everyone has different levels of tolerance for risk. So we know that there will be some people that if there is anything they can do to decrease risk of COVID-19, then they will do that. And that will mean wanting to get a third dose right away. And then there's other people that are more comfortable with a little bit of risk in saying that, we're not having a lot of COVID-19. This is recommended, not required. Maybe I'll wait for a little bit. I think some of the things that people might consider, and I'd encourage people if they have questions to talk to their healthcare provider. We know that the side effect profile of a third dose is similar to the first and the second doses. It certainly doesn't seem to be more. We know that it does seem to offer an additional level of protection. And so if people are potentially in their workplace exposed, there are some individuals over 70 that might still be in workplaces or involved in other gatherings that might expose them to COVID-19. They might decide to take that extra layer of precaution. And they'll also know that, you know, depending on their own health status, if they have medical conditions that put them at slightly higher risk of more severe outcomes, they might decide to get that third dose, again, out of really being extra cautious. So lots of things to consider. And I think certainly over the next month or so, we'll also have ongoing information about as they continue to study people after COVID-19 vaccination, what the impact is of third doses.